Are you experiencing chronic pain or have you been diagnosed with fibromyalgia? I'm going to talk to you today about what we do for fibromyalgia and chronic pain and how it's not so simple. Most time providers want to put their finger on one cause or one reason that someone's having pain or just simply just chase the pain. And the fact is there's multiple factors involved and usually more than one system's involved. Most of the time, people think in fibro or myalgia, meaning the fibrous tissue or the muscle tissue being painful or sore or uncomfortable, and moving around the body and having these, 11 of 18 tender points and that. But it's much more complex than that, and it's involving many more systems. So you'll see headaches, light sensitivity, sound sensitivity. A lot of this is a neurological phenomenon and not just muscles and tension causing the headaches. Let's see, issues in the bathroom, a lot of constipation or diarrhea or a combination of the both, irritable bowel. You'll see reflux, heartburn, weight gain and swelling. We'll have fatigue, chronic fatigue happens a lot. And then you'll have anxiety and depression goes with it, of course. And then you'll see issues with your immune system. Your immune system has trouble fighting when you're being, divided and conquered by all these other issues that you're trying to battle. And then you'll see issues with allergies and libido, and hormones are a big player in how this all plays out. And then, of course, back to the neurology of it all. And sometimes people are told that it's all in their head, but, you just don't think right when, again, you're being divided and conquered. So the deal is symptoms are just telling you that something's wrong. The alarm is going off. So symptoms are not normal. They're telling you something not normal is going on. So my name is Dr. Chad Miller. I'm a board-certified chiropractic neurologist. I work in a multi-specialty clinic called Attain Health Omaha. We're near 140th and Center near Oakview Mall. We work together as a team to kind of create a neurometabolic approach and look at all of the straws in the camel's back to give you the best chance at getting better instead of just simply covering up your symptoms. So then the key question here is, why are the alarms going off? You have to first recognize that the symptoms that you're having is simply an alarm. It's telling you something's wrong, not something that needs to be just tuned out or covered up. Most of the time, the traditional medical model is to tune out or cover up this alarm signal. We don't want to do that. We want to make you functional. There's a happy medium in there, but we want to get to the cause. If you're not addressing the cause, you're just chasing your tail. So where does all this come from? And stress is the big player, and most people think of emotional stress, but there's physical stress, chemical or toxic stress, and then the emotional or neurological stress. So we have to look at all of these components, all of the physical stressors. Do we have a knee replacement? Do we have low back pain or a disc involved? Do we have chemical overload, such as poor food intake or possibly even like chemotherapy, things like that create this situation where, again, you're divided and conquered and you're having these alarm signals go off. So what are we looking at? We're looking at this whole physiological web that all talk to each other and they all play a part. So if somebody has adrenal dysfunction, that's going to promote chronic pain. If they have cellular dysfunction, such as far as their ability to create energy, then that's going to create chronic pain. Immune system, liver, gut, thyroid, these all play a part. So again, chasing the symptoms is like chasing your tail. So we do a multi-specialty, like I mentioned before. So we have medicine, we do functional and nutritional medicine, we do neurorehabilitation, orthopedic rehabilitation, and if needed, chiropractic is available as well. But not everybody gets all of these components. It just depends on what you have, what you need, and what's most effective for your situation. What I will emphasize is our goal is to get people off of medication. So we look at ourselves as a crutch. Once we get the ankle feeling better, we want you to be able to walk on your own and get rid of the crutches. Same with any kind of thing that's helping you get along. So pharmaceutical wise, if you're using something to get by, that's great, but we need to work with a goal to get you off to where you're living your life yourself and not having to rely on these crutches. All right, so our team is just trying to work together to find all of the straws. It's hardly ever one single cause. Actually, I've never seen it actually in the 20 years I've been practicing, but you never say never. So how do we address the fibro? So again, we're looking at all the straws, and so we address it neurologically, orthopedically, and metabolically. So we're looking at the physical stresses, the chemical stressors. We're not a psychological clinic, but we are looking at the neurological stressors, the neurological influences. So we do consider the emotional stressors, but primarily the neurological stressors are where we excel. Okay, so again, the neurology, nothing works without the nervous system. Your bones don't move without the muscles telling it to do so, and the muscles don't move without the nerves telling it to do so. So if you're receiving pain signals, that is your neurology. Your pain fibers are sending those signals up through your spinal cord, up to your brain, and that suffering or that traumatic experience is in your head. So when they say it's all in your head, they are in effect correct, but I don't think usually they know what they're talking about when they do say that. So there's rationale for that, but I'm not a big fan of ever telling somebody that's all in their head, because so we want to look at that balance and try to create that balance. But the longer it's sent into this hyper fight or flight response, your brain listens to that. So the more you pay attention to a certain stimulus, like kind of learning to read, the more you study that information, the better you get at it. So the more your brain is studying pain, the better you get at hearing that pain, perceiving that pain, and suffering from that pain, and then actually having a harder time turning it off. So this directly affects your brain, and there's plenty of studies out there that show that it actually damages your brain the longer this happens, because we need that rest and digest for everything else to function well. Okay, so what do we do orthopedically, or the physical approach? So the gal here, she hit her funny bone. Well, what do? We rub. We tune that information out, and the more we can tune that information out, the less pain we experience and the less suffering we incur. So we want to fire up those pathways of non-painful stimuli, so kind of a no pain approach, as opposed to a no pain, no gain, and try to build up your own body's anti-pain mechanisms. All right, so the metabolic approach is, again, looking at the toxic effects of what's going on, in your body with your metabolism or with your physiology. So what do? We take a look. Are we dealing with anemias? Do we have any issues with thyroid function or blood sugar issues? Do we have gut and liver function the way it should be, or are we seeing some issues there? Hormones play a huge role. Estrogen is kind of anti-inflammatory mechanisms and cardio protective mechanisms. Progesterone actually makes you feel better, literally makes you feel better. If you get some issues with hormone imbalance, that plays a big role. Food sensitivity is another big one that we're usually not kind of in tune with, but it plays a role with our gut and liver function, which then again plays a role with how our blood sugar issue and how our nerves function. They think of our gut as kind of the third brain. But a lot of people, I've already had all these blood tests already. Well, usually they're looking at the bare minimum, number one, what insurance companies dictate, minimum, and they're looking for a disease. They're looking for a disease instead of altered physiology or looking at function. So we're looking at these numbers, and they're all within this range, and they should be all fine. Sometimes yes, sometimes no. So what are normal blood values? Well, what it comes down to is, number one, who's going in and getting their blood tested? Well, more regularly, it's people who are not feeling so hot. So if they're not feeling so great, odds are their numbers are kind of more outside of the optimal range. Well, if they're more outside the optimal range, then that the numbers that the lab goes by and creates their statistical ranges. So what they're doing is then comparing you to F students. So if we are, hanging over there in the yellow area, maybe if we're close to the green, we're, no big deal. But then if we're close to the red, maybe that's something we need to pay attention to, even though it's still considered normal. So we want to compare you to A and B students. We don't necessarily want to compare you to F students. We want to get you to optimal areas. No, nothing's ever perfect, and we're shooting for perfect, but we're not, delusions of grandeur that we're going to get everybody perfect. It doesn't work that way. Life has some ups and downs, but we need to spot those areas that are an issue and do our best to correct them. So the main reason we're getting chronic patients better is we're simply running the necessary tests, and we're not just looking at some disease or one specific problem. We're looking at a multitude of issues. We're looking at all the symptoms working together and trying to see if we can get all of the straws off the camel's back. But this, gives us a much better picture of what we're doing instead of just part of the picture. All right. So again, back to foods and how we kind of fuel the tank. Garbage in, garbage out. So we're not food Nazis, but we have to consider desperate times call for desperate measures, so we need to watch what we're putting into our body. If we're fueling ourselves with bad gas, we can pretty much expect the car to not run as well as we should. All right, so a lot of people have heard of leaky gut. If you have or haven't, no big deal. But basically, it's how your gut functions to break down food and work with the fuel that you're given. So it can create issues. Obviously, most people think of when they eat bad food or eat food that doesn't agree with them, they're thinking gut-related issues. So you can have irritable bowel, you can have colitis, you can nausea and vomiting and that kind of thing. But what also people are sometimes familiar with is how wines, cheeses, cured meats can cause migraines. But what they don't think about is the food we take in can also create depression, can create issues with insomnia, fibromyalgia, which is a big one, and basically inflammation. So it can create issues with PCOS and inflammatory arthritis. So we want to look at that and see if we have this as also a part of the issue. So we need to just look under the hood and see. We don't know if we never looked. So after years of being treated, why are people typically not better? They've been told it's all in their head. They're told they need to exercise more. They've got too much weight on their bones. Or maybe we should just try antidepressants and see if that'll fix your pain issues. In my view, they just dropped the ball and haven't really looked under the hood and looked at try to address all the straws on the camel's back. So again, reiterating, Attain Health Omaha, 140th and Center, but we're looking at all of the straws, and we're multiple people looking at the issues and multiple people with different backgrounds looking at the issues. So trying to work together with you to figure out what the problem is. So again, we're looking at you neurologically, orthopedically, and metabolically. So cleaning up, tuning the engine. Okay, so opportunity for change, couple visits. First visit, just come in for a consultation and see if this is a right feel for you. If this is, something that fits with your view of how you can move forward or get yourself out of this rut. This is the first visit to kind of go through, tell your story. Let us hear what you have to say about what you've experienced. Treatment-wise, test-wise, all of that. We can discuss all of your health history and see if this is something that we feel we can even help you with. We can't guarantee a cure, and we will tell you if we feel like this is maybe not the right place for you. Visit number 2, we'll sit down and go over a treatment plan if we feel that we can help you. We'll go over any further testing, any insurance coverage or insurance issues there, any out-of-pocket costs, and really we only take the people we truly feel we can help. We're not just pulling everybody off the street. This is something that it's kind of a team effort, and there will be work involved, but nothing ever good comes easy. So I appreciate you taking the time to listen to hear me out and kind of weigh Attain Health. Our team works together to address fibromyalgia and chronic pain. If you have any questions or you'd like to meet with us, give us a call, 402-505-3210.